Stuart, you're Chief Manufacturing and Development Officer here at adthera. Just tell us a bit about what your day job involves.
Sure. So responsibility for client programs, their process development, getting their manufacturing process fit for the phase that they're at. That might be preclinical, so that could be really understanding the basics of their manufacturing process through to early phase clinical trial. But one of the things that we pride ourselves here at adthera on is getting it right first time for the long term. We could design a process that is suitable to get a product into a first-in-man clinical trial. But if that needs a team of 8 people working around the clock to make it, that serves no purpose to late phase or commercial programs. So we look very carefully at the manufacturing processes we develop to ensure that the client's needs are met for today, but with a mindset that they will service the future should those products be successful in an early clinical trial.
Thank you. And I mean, you spent the best part of 2 decades in a leading Russell Group university. What's the difference between working for a university and working for a company like adthera?
Universities are designed and exist to educate the future talent. So trying to be a drug manufacturing developer in an academic setting is always a bit of a mismatch. Having said that, everything that's on the market today has come out of academia. So the academic sector is going to continue to feed cell and gene therapy for the foreseeable future. The infrastructure that I had available to me in the university was able to be deployed to do what we needed to do, but wasn't designed to do what we were doing. Whereas here at adthera, everything is built around the mindset of developing drugs for the clients that we work with to get more products to more patients more rapidly. So we don't have some of the roadblocks and the red tape that may exist in academic settings to accelerate client programs.
And it must be, I don't want to put words in your mouth, but it must be quite nice to be able to focus on the research and the outcomes and not be encumbered by public funding mechanisms, by the research excellence framework, by having an undergraduate teaching load.
Sure. I always loved teaching, but I also now love not having to teach, for sure. We focus now on processes for clients. We focus on making the best drug product we can for the patient, and that's my only focus. I don't have to have time devoted to committees and other aspects of academic life that have to exist. I understand why they exist, but yeah, sure, to be free of those shackles is a refreshing change.
And when you walk into adthera, I think the first thing that Chris and I both said we noticed was this real buzz and excitement. It feels like a real hive of energy when you walk into the office. How do you attract those brilliant young minds, the people who, you know, they could follow an academic career, they could do other things, but why is it that they come to adthera?
I think we've been lucky from the inception of the company that, you know, we've an experience in the space. So we've used our contacts and our network to pick the members of staff that are here with us today. And I think that's why we see this excitement of the team that we're building. I also think the chance of being with a company that's early enough to have a position in it that you can still make a change, rather than joining a 500 headcount mid-stage biotech and just being a number. I think that excites people. And certainly the team that we're building get to develop with us and also advise, you know, collectively where adthera should be going and how we work as a team. So I think that mindset we've tried to instill from the start. We've tried to instill a passion for team and collegiate working, an ability to, you know, have complex discussions when they need to be had, making sure we focus on problems. And I think that together has led to a team that really is excited to be here in the day-to-day.
Fantastic. And so how do you retain the team? What's the long term for them?
So as the company grows, there'll clearly be roles that are required as the needs of more clients coming through the doors require more programs. I think one of the beauties of being in a CDMO is that you're not restricted to a single drug product. So one of the exciting things for the scientists is they get to be working on varied projects, and that might be paper-based supply chain challenges, or how do we control raw material handling, all the way through to next generation cell therapy programs. And I think that variability in the work that the team are able to do is one of the things that helps retain them in organisations like adthera.
And at what point are you hiring people? Are these individuals who've just finished their PhD, or are you hiring mid-career, or is it a sort of a mix?
It's a real mix. We've got people with similar decades in the space as I have. We've got people that have come from NHS backgrounds. We've got people that have come from larger pharma that came through an academic program, all the way to recent graduates, and some that haven't gone through a postdoctoral or PhD program. So we pick the talent that's right for the role. And I'm a firm believer of those people that come and talk to us and express an interest and show a spark. The bits and pieces we can teach. I need somebody that has the desire to make a change and want to work as part of a high functioning team. They're the people we want in the company.
So it's a lot of competition out there in the market for talent at the moment, as you well know. What is it that really attracts people to adthera, and what is it that you offer them longer term?
I think as a company, we offer an ethos of inclusiveness and continued training. We're really passionate about getting people that have technical skills that we need, but also have a mindset and a personality that fits with the adthera team concept. We bring expertise in different areas. So we have people that have come from long-term careers in biotech, expertise in molecular biology, expertise in complex immune cell analytics, and we learn from each other. So we have, for example, frequent lunch and learn sessions where one of the team will present a piece of their world, and we want the team as a whole to collectively grow. And I think that mindset of an inclusive and continual learning program within adthera is difficult to see in bigger organizations. And certainly in the academic sector, yes, there is incredible expertise in very, very focused areas, but it's unlikely you're going to see the breadth of expertise that we're building with the team here at adthera in those type of settings. And I think that really excites the people that we're talking to, the people that have joined the company, and why they see their future within adthera.
And I think what comes across very clearly is your passion for training the next generation, but presumably the leadership here can also learn from them. It's a two-way street,
of course,
right?
Of course. We're from an academic background. Training was my thing. We lectured everybody from nursing students, physiotherapists, medical students, across the gamut of science intake as well. I always like to hear from people that we're bringing on board what works well for them. How can we do things better? You've heard previously about how we're integrating tech into the company. What can we do that's smarter to enable training to be more effective, more enjoyable? And by being more enjoyable, it means that the retention of those training events is much more successful. So yeah, we're always happy to have that feedback, and that's again part of the company ethos. Everybody has a voice. We want to hear from the newest recruit to the old hat like me that have been here from day one. What do you like? What can we change? What can we do more of? What should we stop doing? And that's really at the center of our company policy and ethos is what works and what should we continue to progress.